Okay, thank you so much, everyone, for being here today. And we are here today at the county budget hearings on the day that the county supervisors are considering the alcohol, drug, and mental health services budget. And we are here because we are facing and experiencing personally a tremendous crisis in terms of people with mental illness in our community that are going untreated. And we have a continuum of care with serious gaps in it, huge gaping holes in it. And the two gaps that we're the most concerned about as family members are, number one, the lack of a sufficient number of acute psychiatric beds. We have 16 beds at the psychiatric health facility called the PUF unit in Santa Barbara, and we have 5 beds that are contracted by the county at Vista Del Mar and Ventura, but we need hundreds of beds. And there was a proposal in this budget initially to cut some of the beds at Vista Del Mar and to realize some savings on the money that's being spent at the PUF beds. Regardless of how it's done, the beds must not be cut. They must be doubled in number. A few weeks ago, there were 5 people in the county jail that were in psychiatric crisis, that desperately needed a psychiatric bed, and 10 people in the emergency rooms around the county who needed at that moment a psychiatric bed, but there were no beds available whatsoever. So our demand to the county is not only must you not cut the number of acute beds, you must double them. And the other gaping hole in our continuum of care is the almost complete lack of residential treatment beds. And residential treatment takes different forms. Phoenix House of Santa Barbara is an excellent social rehab model, but it only has a few beds. We need hundreds more. We need a different model for people whose primary problem is substance use. We need a different rehab model, something along the lines of Delancey Street. So our message to the county is we can no longer afford to have you guys figure this out on your own. The solutions are going to come from a collaboration. We've got to get radically innovative, and we must sit down at the table with Cottage Hospital, with the housing developers, with the nonprofit sector, and the private philanthropists, as well as the city and the county, to develop beds. Right now, we need to double the number of psychiatric beds out of this budget. And then we need to put some money aside, possibly $1 million aside, to develop residential treatment beds. We are putting aside over $1 million per year in this county for a new jail. But guess what? We don't need a new jail. We've had a drastic and steady reduction in the number of violent crimes in our county, in our state, and our country for the last few years. This is not the direction we should be putting our money in. We need treatment. We don't need jails. So we need beds, not bars. Beds, not cells. And guess what? In order to rehabilitate a whole portion of this population, we need jobs. They're going to have a treatment center, and they're going to need job training and an actual job. Thank you so much.
Good afternoon. My name is Sharon Rose. I'm executive director of a small nonprofit agency, and I had a 20-year career in public health program management. During that time, my son was growing up as a young man. He was bipolar. He was in and out of jail, out of hospitals, and out of psychiatric treatment. Finally, he got around to a caring residential treatment program that gave him enough time to get stable, to get off drugs, and to renew his life. Today, he's a successful father and businessman, and he's doing great. And I like to share this story because treatment works. Residential rehab works. We cannot continue to ignore the people who need help by putting them in jails. It's not an answer. It's a waste of money. At any given time, 70 to 80% of the jail population is made up by people with behavioral problems. Treatment is cheaper. It's cheaper than jail. We know the county's job is not easy. They don't have a money tree. This is a hard job. They have to figure out where to spend the money. In public health, we have a model called prevention. When people were getting sick with waterborne diseases, we didn't build more hospitals to take care of them. What we did was change the regulations and take care of the root problem. We passed regulations to get the diseases out of the water so people stop getting sick. We need to do the same thing with mental health and drug alcohol problems. Prevention is the answer. It has been suggested that the money can come from oil and gas revenues. You know, in Santa Barbara, we have a memory of the first disastrous oil spill off our coast. It devastated marine life as well as our local tourism economy. That's not a place we can go to. That's an unacceptable answer to find money. The Families of Families Act, we are speaking to the crisis by talking to housing agencies, by building a collaborative, by being creative and innovative. We do not expect the county to do it all. We want to build a collaboration with the private sector, with housing, with cities, with Cottage Hospital, with everyone involved to create more facilities with private donors. Thank you for coming, and please stay involved. We can do this. Next is Susan Reed.
I know. Hi, my name is Susan Reed, and I'm a mom and an advocate for the mentally ill. I'm here today to tell my story. My son is schizophrenic, and he's been homeless for a number of months now. Unfortunately, he is not able to take care of himself, and because of that, he ended up at Cottage Hospital with a super infection about a week and a half ago. He was treated for 5 days, and I contacted the PUF unit to let them know that John was going to be released because medically he was good enough. He was well enough. I was assured that John would have a bed to go to because my son is mentally incompetent. He is psychotic. As hard as that is to say, it's very painful to try to help someone that cannot help themselves. Anyway, I was assured this bed, and I also asked the hospital to let me know when John would be discharged. John unfortunately fell through the cracks. He never got this bed that I was more or less promised because we didn't have one for John in this entire county. My son needed help desperately. He was discharged at 5:40 on a late Friday afternoon and into the streets with the few items that he came into the hospital with. I had no idea where my son was. I didn't know if where was he sleeping? Is he going to be hurt? My son's been beat up, spat on. The looks that he gets on the streets it's just horrible. And this is a beautiful human being. I love my son, and I'm here to fight for him. I'm here to fight for the beds that we desperately need, that we need here in Santa Barbara. I guess that's all for now. I hope I've made sense with all this. Thanks.
Hello, my name is Debbie McCoy. I am a registered nurse, and I'm Trisha's mother. Trisha grew up in Santa Barbara, went to school here, graduated from San Marcos, and will be 21 in September. 2 years ago, she developed mental illness. Her father and I made several attempts to help her, but she refused to take any medication because she does not believe that she is sick. So why would she take any medication? Back in March, my daughter felt she needed a car and went to Toyota's showroom. Shortly afterward, she was arrested for driving away in a car that Toyota had, in her words, given her. Toyota thought differently and reported it as a theft, a felony, the first crime she ever committed in her life. The supposed gift gave her 6 weeks in an isolation cell at the county jail, 4 weeks at the psychiatric health facility unit, and so far, 3 weeks at Patton State Hospital. Last evening when we spoke, she reported that she is housed with, quote, bangers, druggies, and thugs. Everything that I never wanted to be, Mom. She is the youngest patient on her ward and probably has the shortest rap sheet. At the transition between jail and Puff, we waited for 4 days before she could be transferred because Puff had no beds. When we were in court on May 25th, which is only 19 days ago, a county employee informed Judge Anderson in an open courtroom that the Puff needed Trisha's bed as soon as possible because there were 5 inmates in the county jail and 10 others in various ERs across the county who needed her bed. Imagine 16 people fighting for the very same bed. We are here today to discuss cuts to the alcohol, drug, mental health services budget, which includes cutting the number of beds available to young adults with mental health issues. I say it is preposterous to even entertain such a notion. And my concern does not end there. I wonder what will happen when my Tricia is returned from Patton, having been declared competent enough to assist in her defense, is put on probation and ordered to take medication. Where will she live then? She is now an adult who is at that stage in her life where she no longer wishes to be with her parents. This is a brave step for any young adult, but a young adult with mental illness is very likely to get in a revolving cycle of crime and incarceration rather than being supported in a system that assists her to make wise choices and learn more life skills. She will need assistance filing for disability, getting on Medi-Cal, and maintaining a life until she is stable enough to transfer to a lower level of care or to independent living. She has no money, and unfortunately, her parents have no money right now, and neither of us has a place where Tricia can go and live with us. And she'd refuse to live with us anyway. I already anticipate that there will be no place for her again. For all of the Tricias in the system who do not have a nurse and a lawyer for parents advocating for them, I urge you to find some way to not cut the number of beds in our county, but to increase the numbers significantly in both North and South County. From Tricia's experiences, I can only conclude that we need beds of every kind. Acute care treatment beds on a locked ward, all the way down to board and care and independent living. Thank you.
Hello, my name is Deborah McRoberts, and I am a grateful member of Families Act, which is Family Advocates for Compassionate Treatment, started by Suzanne Riordan, who's been doing this for about 6 years now. Finally, we have a group that has a voice somewhat, and we're urging them not to cut beds and cut to the people that have no voice in our community. According to the county's own report, 72% of those housed in jail are either mentally ill or substance abusers. And then when they've served their sentence, after being jailed, making no decisions on their own for quite a long time, they're released often right in the middle of the night with no supervision, no support, no guidance, having lost a job, having probably lost their place to live. And we wonder why there's a big recidivism rate. Recidivism meaning the revolving door of the jail. They get out, and then a couple weeks later, they're back in. We need new treatment centers. We need a new program. We need something that's going to help people rather than jail them. We need beds, not bars. Thank you very much.
Hi, my name is Meredith McCurdy. I'm a mom. My son was stabbed and his father was murdered in 1978, and he has been suffering from post-traumatic stress syndrome ever since. Last August, he was arrested May the 11th, he was released and ordered to go to a facility to get his health back mentally. He was diagnosed as bipolar in the jail and given medication. I was to transport him to a facility. He was released at 2 a.m. from the jail, called me the next morning, did not go to a facility. I couldn't get anyone to help take him there. He since has attempted robbery, lost all his money, lost his ID, lost his wallet, lost his clothes, lost 4 pairs of shoes, tried to pick a fight with our pastor. Violence is escalating. He has never been a violent person, but he seems to be now. Someone could have helped him go. Someone of authority, a deputy, a sheriff, could have taken him to a facility, but no. I think there is a huge gap in the bridge between judicial orders and law enforcement. And in that gap, at the top of this bridge, those who need it most fall into the troubled waters beneath. Please help us get beds and help for those who need it and can become good citizens, paying taxes and reducing the cost of recidivism. Thank you.
Good morning. My name is Agris Petersons, and I'm a social worker. I've been a social worker for 40-some years, worked with the state and then the county in Santa Barbara. And in 1970, when I came here, I came in 69, but in 70, Santa Barbara had one of the best mental health programs in the country. People were looking up to us. We had 5 different clinics here in the South Coast, 3-day treatment programs, and a variety of board and care, room and board, independent living, not as much as independent living, and people were getting help. Last night I went to the FACT meeting, and I was again just felt so sorry and so bad for all the parents that were there who were struggling with their children, trying to get help for them, because there's not enough beds in the psych unit, not enough beds after the psych unit. Where do they go after that? So many times the PUF has to keep the people in there because there's no place for them to go, and sometimes they have to release them when they shouldn't. Even though I retired in '99, I been back to work on a part-time basis at the psych unit and also in an ACT program. And even though we feel that we're doing better services for mental health clients, I see people who need care, and in order to prevent them from going to the psychiatric unit or any locked facility, they end up going to maybe a motel in town. And in 3 or 4 days, the manager is kicking them out because they cannot. They need more help than they can get in a motel. So my concern is that we do need more beds and not put people in jail. It's inhumane. In a country like ours, we should be providing services for the people with mental illness, not putting them in jail. So again, more beds and less bars. No bars.
Hello, I am Sayre McNeil. I'm an attorney here in town, and I have a personal history of mental illness. I dropped out of law school in 1980 with my first clinical depression. I suffered it periodically until about 1990 when I next went on medication and it was successful. And then in 1995, out of the blue, I had a manic episode, and I ended up being hospitalized at Vista Del Mar, thanks to the intervention of my family, for 72 hours on a 5150 hold. I got out, I got myself set up at the Miramar, where I started welcoming the mentally ill homeless into my cottage that I had set up there. This did not go down well with the management at the Miramar, and I ended up being taken by the police to the PUF unit here in Santa Barbara, which you've heard of before. Fortunately, I have a compassionate family with the resources. I got help, and I've been medically stable since then on medication. However, at the same time, I had a stepdaughter who was diagnosed schizophrenic, ended up being homeless, and because of minor transgressions, went in and out of jail. I'm here on behalf of Families Act to advocate for compassionate treatment of the homeless mentally ill. And compassionate treatment happens to be also the most cost-effective treatment. About 6 months ago, the county published its own report by the county executive office comparing the costs of incarceration with stabilizing services for the homeless mentally ill. We now have documented that it costs approximately 25% more to incarcerate a mentally ill person than to provide them stabilizing services. And the primary service that is needed, according to this report, is housing. Housing, along with mental health and substance abuse treatments, as well as, and medical treatment. The county estimates that there are 6,350 homeless people in the county, of which a third are mentally ill. That's 2,100. According to this report, housing is the primary stabilizing service required to assist the homeless and mentally ill individuals and prevent them from reoffending and returning to jail. It also states that the effectiveness of treatment is directly proportional to the stability of housing. We need and we advocate for housing and supportive services and comprehensive treatment for the homeless mentally ill. Thank you.
I wanted to share with you that I've spent the last few days and nights at Cottage Hospital in the beautiful, brand new wing because my sister, who suffers from severe dementia, was in a life and death crisis. And I am astonished at how luxurious that wing is. It's absolutely beautiful. And the patients are in their own room. They have a big, gigantic room on the ward where she is. And it's a wonderful thing. They're treated with dignity and care and love. But guess what? These are the people who are experiencing a physical illness. The many, many hundreds of people in our county who are today experiencing a mental illness are not in those rooms. Most of them are in the ER or on the streets. The Cottage Hospital is required by law to take someone in a life and death crisis, even if it's a mental crisis, into their emergency room for 24 hours. In fact, now they are keeping them longer because there's nowhere else for them to go. It's not necessarily legal for them to keep them longer, but maybe out of compassion they are, up to 5 or 6 or 7 or 8 days. This is a symptom of the problem in our community. We have extremely few psychiatric beds and even fewer residential treatment beds for the hundreds of people that are unlucky enough to be suffering from a mental illness rather than a physical illness. So we want Cottage Hospital to sit down at the table with us because they're going to be part of the solution. Their mandate should be to serve people who have physical illness and mental illness. They're going to be part of the solution, but we've all got to sit at the table. Today we're asking for the county not to cut, but to increase the number of beds. But in the future, we're going to have to develop. We're going to have to develop in a very innovative way, sustainable residential treatment, and we have some ideas how to do it. Thank you so much for being here today.
Beds, not bars. 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 Beds, not bars.
Today we had a press conference with the FACT program where we wanted people to know that we need beds instead of putting people in bars. But it's not just something that the county itself can do. We need the support of all the people in the Santa Barbara County. We need people to help volunteer with our program. We need people to donate money, to donate property, donate anything they can to make this whole program worthwhile and develop more places for people to live and be able to maintain themselves in Santa Barbara.
I'm Suzanne Riordan, Director of Families Act, and we are appealing to all the residents of Santa Barbara County to help. We've got a tremendous crisis on our hands. We need your help for people with mental health disorders. We need beds, and we need property. We need buildings, and we need volunteers to help mentor people with mental health disorders. If you can help in any way, go on our website, familiesact.org, www.familiesact.org, or call Families Act at 805-637-1339. Thanks so much.